अभी म्यूट कर लीजिए। गुड आफ्टरनून। नमस्ते मैडम, गुड आफ्टरनून। थैंक यू। एक्चुअली केस में तो टाइम लग गया, अभी क्लोजर हो रहा था, इसलिए आई हैड टू स्टे बैक। अदरवाइज मैं आपके साथ ही हूँ वैसे भी ऑनलाइन।
थैंक यू सर, थैंक यू सो मच, थैंक यू वेरी मच सर।
जब भी स्टार्ट करोगे आई एम अवेलेबल, ठीक है? आई एम हियर।
थैंक यू सर।
थैंक्स, बाय बाय। स्टार्ट हो जाएंगी, ये उनके बचेंगे।
है ना, चारों की
श्रीवल्ली
बाकी घरवाली का नाम श्रीवल्ली तो है।
श्रीवल्ली
उसके बाद 5 मिनट में फिर से जी डॉक्टर साहब चालू कर सकते हैं। आई थिंक स्टार्ट कर दीजिए। जी
Respected guests and delegates, on behalf of College of Nursing and Department of Radiotherapy in Raipur, I take this opportunity to extend my warm welcome to all attending this webinar. Why cancer? 10 million people die each year from cancer. More than 1/3 of cancer cases can be prevented. Another third can be cured if detected early and treated properly. Despite the resources, appropriate strategies on prevention, early detection, and treatment, still the mortality is high in cancer patients. With the vision to identify and address the barriers that exist for many people around the world in access to the care of cancer they need, this year, the World Cancer Day is observed with the theme Close the Care Gap, Realizing the Problem. So moving ahead, I would like to call Mrs. Rohisha Aike, Nursing Tutor, College of Nursing, to deliver the welcome address.
Thank you, ma'am. Good evening to everyone over here. A warm welcome to the webinar on the theme Close the Care Gap, Realizing the Problem on the occasion of World Cancer Day observation. I am overwhelmed to welcome our respected chief guest, Professor Dr. Nitin M. Nagarkar, sir, Director and CEO, AIMS Raipur, to this webinar. A warm welcome to respected Dean, sir, Professor Dr. S.P. Dhaneria, sir, to this program. With great pleasure, I welcome Dr. Siddharth Nanda, sir, Additional Professor, Radiotherapy Department, AIMS Raipur, to this webinar. A warm welcome to Dr. Binu Matthew, ma'am, Assistant Professor, College of Nursing, AIMS Raipur. Welcome. It's a pleasure for me to welcome Mr. P.D. Deepak, Dr. Solomon James, and Mr. Abdul Munaf, Nursing Tutors, College of Nursing, AIMS Raipur, as the keynote speakers for this webinar. I extend my cordial welcome to all the respected faculties, officers, and staff members of AIMS Raipur. It is a pleasure for me to welcome all the delegates and students to this webinar. Your presence is highly appreciable by all of us. I welcome all the participants who are attending this webinar. I wish you all a happy learning hour. I also welcome the staff of IT department and PRO department and other departments who are here to support us. Once again, I welcome you all. Thank you.
Very nice.
Thank you, ma'am. It gives me immense pleasure to invite our mentor, guide, and teacher who is always there to support us in all our ventures, Professor Dr. S.P. Dhaneria, sir, Dean Academics, AIMS Raipur, to enlighten us and give us his blessings. Sir, please.
Honorable Director, sir, Professor Nitin N. Nagarkar, my colleague, Dr. Siddharth Nanda, Dr. Binu Matthew, dear tutors, resident, students, and guests. I extend warm welcome to all who are attending this webinar organized by College of Nursing in collaboration with Department of Radiotherapy. As we all know that in later half of post-independence era, we started facing the problem of non-communicable diseases like ischemic heart disease, hypertension, diabetes, resistant infections, neurodegenerative disorders, psychiatric illnesses, and also the cancer. So there is a need to make the people aware about the malignancy, cancer, what can be the preventive measures, what can be the warning signs, what is the advantage of early diagnosis. Also, to eliminate the apprehension and anxiety that cancer means death, because there are many malignancies which are almost curable with the available therapeutic modalities. And also, if it is incurable, it's not curable. We have the therapeutic modalities to make the people as comfortable as possible till the end. So, it has. I have been always observed that the College of Nursing has always taken a proactive role in organizing the program for making the people aware about the problems related to the health, and always on World Cancer Day, the very remarkable contribution is from the Department of radiotherapy. So both have always worked in collaboration. So I congratulate entire team and resource faculty for organizing this webinar. And I hope that you will work in collaboration in coming time with the same enthusiasm and zeal. I wish this webinar a grand success. Thank you very much.
Thank you, sir, for enlightening us with your kind words of wisdom. It will be a privilege for me to invite an ideal example of inspiration and motivation for all of us, our Honorable Director, sir, AIMS Raipur, Professor Dr. Nitin N. Nagarkar, sir, to shower the words of wisdom and kindness. Sir, please.
Thank you very much for the kind words of introduction. Professor S.P. Dhaneria, our Dean, Dr. Siddharth Nanda, Dr. Binu Matthew, Mrs. Rohisha, Mr. P.D. Deepak, Mr. Dr. Solomon James, Mr. Abdul Munaf, and all our faculty members, staff, resident doctors, all of us who have joined us online as well as offline. Thank you very much for this very important celebration which we are doing on the World Cancer Day under the joint participation of the College of Nursing and the Department of Radiotherapy. I think both these departments have been very proactive when it comes to such kind of awareness programs. And I think we must take those steps, very rightly mentioned in the initial remarks, that many of these cancers happen to be preventable. Many of these cancers can be detected much earlier and we can almost bring them back to their normal life, the kind of therapy is now available. So that takes care of almost 2/3 of the patients that way. Only few cases which are picked up late. And for that also, I think for institutions like ours, we are participating in various types of research where therapies for so-called incurable cancers are also now available. Also, there are also early detection modalities which are available to us. So at the same time, the theme is so relevant, close the care gap, realizing the problem. I think AIMS Raipur has done a wonderful job. We have got departments for diagnostics, whether it's the radiodiagnosis department, pathology, nuclear medicine. We have treatment modalities available. We have the Department of Radiotherapy. We have Dr. Siddharth Nanda here. Most world-class facilities, whether it's the linear accelerator or brachytherapy and otherwise are available. Similarly, we have the medical oncology department. Surgical oncology is practiced by various surgical departments, specialty and super specialty. We see a lot of head and neck cancer cases, a lot of cases of breast cancer, as well as cervical cancer. So I think we have also played a proactive role in early detection of what the government has always emphasized on oral cancers, breast cancer, and cervical cancer. And this has been included as the part of the program even for the wellness centers which have come up in different parts of the country and which is envisaged for the future and which is already being done. We'll all have to work together. Here, this is one particular care which always, I think Dr. Nanda will agree, we always talk of comprehensive cancer care. We always talk of under one roof, all facilities being available. And we are fortunate that in AIMS Raipur, we have got a wonderful team with all the infrastructure which is necessary for detection, diagnosis, and treatment of all these kinds of cancers. But at the same time, I think we have got a very important role to play in terms of awareness, in terms of spreading the message to the public, how to take care of themselves, how to prevent those cancers which are preventable. Avoiding tobacco is, I think, one very big thing which can really impact cancer care and reduce the number of the burden of cancer that we face in our country. At the same time, people should be made aware that yes, cancer can be detected early and it is not a death sentence, it is curable. Only you have to seek the right treatment. And unlike in the past where there were only few centers dedicated to cancer focused in certain parts of the country, thanks to the vision of the government, we have so many centers now. These new AIMS itself, they have made a huge impact, not only for COVID, but for the non-COVID, including mainly cancer. So I always look at it very positively. I am very happy that we've got such a wonderful team. And that is the reason for my positiveness that we will definitely achieve the dream of cutting down the number of cancer cases, and also whichever cancer is there, we should be able to treat them to the best possible result and satisfaction of the patient concerned and his family. So thank you very much for inviting me. I am very, very honored, and really it's a very relevant topic that you have chosen. Thank you and best wishes to all of you.
Thank you.
Thank you, sir, for your kind words, constant motivation and support. Now proceeding with the session. Darkness cannot drive out darkness. Only light can do that. With this thought, to focus the light on the theme for World Cancer Day 2022, I request Dr. Siddharth Nanda, Additional Professor, Department of Radiotherapy, AIIMS Raipur, for unfolding the theme.
Respected Director Sir, respected Dean Sir, respected colleagues from the nursing faculty, nursing department, my colleagues from my own department, and all the students who are online, and all the people who are watching us online, all the support staff. Thank you very much for giving us opportunity to have this presentation today. Without much delay, I would like to go into the presentation. The topic that has been given to me is to close the care gap. Is the theme of today's presentation. So non-communicable diseases, including cancer, are among the World Health Organization's top 10 threats to global health. Now, how we can close the care gap? It is to identify and address the barriers that exist for people around the world to access the care they need. Now, I'll give you a small example of what is equality and what is equity. We want cancer care to have some equity, not equality. Like you can see on the image on your left, a small child is given an equal seat as the elder siblings, but the child is unable to see the football match. Look at the right image. We have just lifted the seat so that the child also can enjoy the football match. So what we need to do in cancer care is to make resources in such a way available so that everybody is equal in receiving the care, and that will become the equity. This year's theme is to realizing the problem. The further themes are uniting our voices and taking action, and 2024 will have together we can challenge those in power. Now, equality means, as I told, each individual or group of people are given the same resources or opportunities. Equity means recognizing that each person has different circumstances, and therefore he or she requires resources and opportunities specific to their situation so that everyone can enjoy an equal outcome. Inequity is often a result of social determinants of the health. These include where you are born, how you live, what you have learned, where you work, what is your religion, and age. All this can affect the concept of equity and equality. Now, inequality is there everywhere. It is right there in our backward. We have a difference of men and women in our own families. Sometimes women are not given that much of importance. Children and older people are also in the receiving end because they cannot put their point forward, and they are not cared for in most of the families also. Lower socioeconomic strata population people, they do not have the access to come to the hospitals. Rural remote populations again face the similar issues. It is a surprising fact that 90% of the low and middle income countries, LMICs, do not have access to radiotherapy, which is one of the essential ways to treat cancer. Only 5% of the global population resources for cancer prevention and control are spent in the LMICs. By 2024, demand for chemotherapy would rise to 15 million from 10 million, and that too, 2/3 of this demand will come from LMICs. Now, another example, 70% of the people who die of cancer are above 65, yet this age group faces disproportionate barriers to their treatment. Look at the survival rates of childhood cancer. 80% children would survive if they are treated for their cancer in a high-income country. But look at the dismal results in our own countries, 20% in low-income countries. 90% of cervical cancer mortality occurs in low and middle income countries. India is one of them. You can see in the map. So it's a disaster that we are heading at. Now, what is the need of the hour? Need of the hour is equity in access to cancer care so that we can close the gap. No matter who we are, what is our status, where we live, where we come from, We all deserve the access to accurate information on cancer, because accurate information will lead us to proper quality of care services, be it in prevention, diagnosis, treatment, or end of the care, supportive care. Now, how we can go for prevention and risk reduction of cancer? Simply by choosing healthy foods, moving more often, quitting smoking and alcohol, avoiding pollutants and chemicals, and getting vaccination whenever it is required. Finding cancer early always makes it easier to treat and sometimes even cure, which means improved chances of survival and better quality of life for people who are diagnosed with cancer. Early diagnosis leads to better care and better quality of life. Each one of us can be empowered with the right information to know what's normal for our bodies and recognize what is abnormal or unusual. So these are various things which can be taken as cancer signs and symptoms, like unusual lumps, persistence, cough, breathlessness, difficulty in swallowing, changing bowel habit, needing to urinate urgently, unexpected bleeding from any site like the vagina, anal passage, or passing blood from while urinating or coughing, unexplained weight loss, fatigue. There is the development of new mole or change in an existing mole, unexplained or ongoing pain somewhere that is not subsiding, lump in the breast, feeling less hungry, sore that doesn't heal in mouth or in the head and neck region, persistent painful heartburn, all these things. These are early signs which can be explained to anyone, and patient who find this symptom should report to their medical professional or the physician immediately. What can we do? We can do a lot of things. As an individual, we can teach ourselves and people close to us, including parents, caregivers, teachers, and others in our communities who can in a way influence others about the common signs and symptoms of cancer, so that people are aware. Only when they are aware, they will go to a healthcare facility. Health professionals need to understand the signs and symptoms properly. Like the departments which are unrelated or not treating the cancer should also be aware, so that they do not go for a misdiagnosis and keep on treating a cancer patient, like say, for example, tuberculosis for years together, and patient doesn't have a chance to cure. So encourage the value of early detection, because that is the key. Early detection will lead to cure. Now, this year, the spotlight of UICC is on cervical cancer. Just to present a few facts, where we stand in cervical cancer. 600,000 new cervical cancer cases are diagnosed every year globally. Every 2 minutes, a woman is dying from cervical cancer. It is the leading cause of death in women over 40 countries. 300,000 women each year die from cervical cancer. And where do they die? 90% of all cervical deaths occur in lower and medial income group. So you see where we stand. Now, in higher income countries, why it has a great impact on cervical cancer and why the incidence is low? Because girls have the opportunity to be vaccinated against HPV, and women are screened regularly and treated early for any precancerous lesion. These are the two most important preventive measures for cervical cancer. By these two measures, up to 80% of cervical cancers can be prevented, and maybe in future we'll be in a position to eliminate cervical cancer completely. Where is the inequality in cervical cancer? There is limited access to prevention and early detection in LMIC countries. Even with screening programs in place, 55% of low-income countries lack access to radiotherapy and surgical services, which are critical to treating cervical cancer. Although there is screening, but there is no facility for treatment. Women and girls living in remote areas face considerable challenges and barriers to access healthcare services. We must ensure that the same life-saving services are available for all the girls and women wherever they are. Without action, cervical cancer deaths will most certainly rise a further 50% by the year 2030, which is not far away. What action we can take? To eliminate cervical cancer, we need action by everyone, including community persons, businessmen, religious leaders, healthcare professionals, teachers, educators, families, and individuals. So first thing, get informed. Knowing more about cervical cancer, its risk factors, signs, symptoms, common misconceptions would help. How we can act? By encouraging prevention, regular screening, treatment among women and girls in your family and community, and if appropriate, if available, they should be vaccinated. Now, what we are contributing as a department to cancer cervix? we are treating almost 8 to 10 cases of carcinoma cervix by external beam radiotherapy, which is a protracted course of 25 days of external beam radiation, almost like a month of therapy. And I'm very happy to share that after inauguration of the brachytherapy since November 2021, we have treated 30 patients and we have done completed almost 90 intracavitary applications for carcinoma cervix. So that's our contribution in a short span of time. And let's give everyone a chance with equitable access to cancer care. Thank you for your kind attention.
Thank you, sir, for this wonderful briefing. Now proceeding with the next session, I would like to call Mr. P.D. Deepak, Nursing Tutor, College of Nursing, AIIMS Raipur, to address the key issues in cancer care.
बढ़िया करा किया, बहुत अच्छे facts थे, पूरा 8 मिनट रखा, बहुत अच्छा, बहुत
Thank you, madam. So before I start my session, I'd like to thank our honorable director, sir, our respected dean, sir, and all the organizing committee members who gave me this opportunity to stand here and present the topic today. We are celebrating World Cancer Day 2022. It is as sir has already pointed out, it is the need of the hour. So you can see an image in the slideshow right now. So we can see here, whenever we talk about a cancer patient, what is the first image that clicks on your mind? What is it? We see a patient. We see the patient with a lot of pain and agony. We see a patient with a lot of, if the patient is in hospital, we see the patient with a lot of tubes, with a lot of bandages, or maybe a bald head. That is the first image it comes to our mind. It strikes to our mind. So yes, indeed, the cancer patients are having a lot of pain and agony in their life. The cancer patients always they cross their fingers and they sit and they pray to the God that I should live for one more day. Should the treatment which are being given to me should be working for me. It should be helpful and I can survive so that I can provide my family for the next future. So this is what happens to a cancer patient. There are a lot of choices which the cancer patient has to make. Like they have to pick this, they have to drop that, they have to skip something, they have to choose something, maybe if they like or they do not like. So there are a lot many choices they have to do. So it is the bitter truth, but the good is, as sir has pointed, there are honorable director sir also pointed out that there are the word incurable. Now it is not such a fact which was there earlier. So we are in our era, we are having so much of sophistication that we can treat many of the cancers. It is curable, but yes, if it is detected on time. So that is important. We are providing as a healthcare professional, we are providing, each one of us is doing our part in the healthcare. But still the bitter truth remains that still there are many gaps, there are many issues in cancer care which is still surviving, which is there in our society, prevailing in the world, which is preventing us to render a very good quality cancer care to the patients. So a very warm welcome to all the dignitaries present here. Very warm welcome to all the delegates who are attending this webinar online. So I'm P.D. Deepak, Tutor College of Nursing in Raipur, presenting this topic on key issues in cancer care. So as I say, there are many issues which are there, which we should address so that we can render the best possible quality care to the cancer patients nowadays. So first, as sir has already pointed out, Siddharth sir has already pointed, equity in access to cancer care. Now, whenever we talk about equity, it is kind of a synonym to the word equality. Now, it is different. Sir has pointed a lot of points in it. So basically, equality means you give equal resources to all the people. But equity means when you give everything needed to everyone to come to a similar position or to come to a same position. That is equity. So sir has given very good examples as to how equity, like 90% of the cervical cancer patients are dying in low income group countries. Why it is so? The issue is that we have to understand why it is happening, and we have to act as an individual, as a group, as a community, as a government to tackle what is the problem, why this inequity is happening. That is the problem. Now, there are many barriers which are coming, which comes to tackle, or you can say to bring this equity in the cancer care. There are a lot many, we can see some gender norms, poverty, rural-urban divide, discrimination. There are a lot many things, but it will be discussed later as a separate session today itself. So I'll not go in detail for that. Next, we talk about prevention and risk reduction. Like we can think of how it is prevention and risk reduction is a issue. No, it is not an issue. Issue is that we are not aware, or the awareness regarding the prevention and risk reduction is less. As Dr. Sir also has pointed that many cancers are now it is not incurable. We can cure those cancers. So we have to think that risk reduction is a very good option to cancer care now. So there are very much known risk factors like alcohol consumption and smoking. And we have seen as soon as we have seen the many Western cultures, the consumption of alcohol, smoking habits, these behaviors are creating a lot, or it is getting in depth in the society now. And it is being a risk factor to develop lot many cancers in society today. We have become sedentary. We are becoming sedentary. The physical activity levels are going to very low levels in all people, especially in the people who are office people like that. And people who are working on open places, they're more prone to have irradiation with this ultraviolet radiation. So they're more prone to have cancers like skin cancers. Then the workplace hazards, like the people who are working in a dye factory, obviously they are prone to inhale those dyes, and they are prone to have certain kind of cancer. So we need to address these issues. We need to understand that workers and employees need also to be protected with all these kind of harms which can be there. And vaccination, what is the point of vaccination? As Sir has pointed out, HPV. Now, when we talk about certain cancers, they already are associated with some kind of viruses. Like if we talk about liver cancer, it is associated with, we can say, many viruses, which includes hepatitis B virus, and which when we talk about cervical cancer, it is associated with HPV virus, that is human papilloma virus. Now, some of the vaccines are included in the national immunization schedule, like hepatitis B, it is there, but HPV, it is not there. So it is a need of ours that we should understand these. By vaccinating these people, we can reduce the risk. So that is also an issue. Now, next is some myths and misinformations or misconceptions which are prevailing in the society. Like first, it is incurable. So 100% we can tell it now. It has to be conveyed to the people in large that it is not at all incurable now. We can cure it, but only thing we have to find it on the proper time. So that is where the screening and early detection comes into action. So screening is very important. There are many cancers, like we talk about breast cancer, we talk about testicular cancer. So there is breast self-examination, testicular self-examination. There are many screening modalities available. Only thing is that it is not, like people are not aware of it. We have to spread it more so that the people can become aware and can prevent these kind of disease to happen, or if at least they cannot prevent, so at least they can find it or you can detect on a proper time so that it can be treated early. So it is not uncurable now. You have very live examples like Armstrong, a famous cyclist who was there. So he was detected with a testicular cancer, but still he fought that and he's living, right? So we have many other examples like Yuvraj Singh and all. So these are live examples we have. It tells you that it is not an incurable disease. So that is an issue that we have to convey, that it is a curable disease, because people who are from the low economic background, they think it is, they are diagnosed with cancer, no, now I'm going to die. So it is not a case. We have to go, we have to check for the healthcare professionals. We have to go and see the healthcare professionals, and we have to believe that it can be cured. Then people who think, another famous myth is, if I do not have a family history, then I am risk-free. I will not be able, or I will not be affected for any cancer. Again, that is also a myth. So it is not correct. Anyone and everyone can get cancer. Only thing is that it is because of mutations. Mutations happen to anybody. So you should not think we are risk-free any time. But it is a thing we have to be screening on proper time. It is contagious. Obviously, it is not contagious to people, and it becomes a risk factor where when the people who are suffering from cancer, people tend to get away from these. Obviously, we are not having this misconception, but many areas in many countries, poor countries, they are having still this misconception. So these are the still issues which are there prevailing in cancer care. Next point, it is in mental and emotional impact. Obviously, other than the physical impact, you have a lot of mental and emotional impact. It is a very large topic to be discussed. Again, it will be discussed by our respected Dr. Binu Matthew ma'am. So I'll not be discussing much about that, but obviously we have to understand that emotional and mental impact is much, much larger than the physical thing. Next is financial burden. If you talk about, yes, we all know that the financial burden on individual and families is very, very great when we talk about the cancer treatment, or whenever a patient gets cancer, the treatment costs a lot of money for that particular patient. And it is not only affected the individual or family, it is also affecting the nation. How? The money which had to be utilized for the development of nation, what happens to that money? It goes into the treatment of the diseases. And the diseases, I'll remind again, which are preventable. We have said that there are many, sir has pointed, more than 1/3 or more than 2/3 diseases, cancers are those which can be preventable. So we are wasting our financial resources on things which we can prevent. So that is our need of the hour. This is an issue. And you can see many of the families who, even one of the members having cancer, the family will be crashed completely economically because of the treatment, treatment which has to be done for that family member. So it is a very big issue now, which is there. It may not be in our country, it is still there, but it's not on a very large scale. But the people, again, the countries with the low income group, they are facing this very much. Now, skill gap. Now, again, it is a very big issue for many countries. We are talking about the global issue, so it is an issue. Skill shortage. Now, there are many countries who are lacking simple, people like medical oncologists. They lack the nurses who are specialized in oncology care. So this is the shortage of the people who are trained specifically, who are skilled enough to treat these patients, to care these patients. So that is again an issue in the cancer care when we talk about on a global level. Now, skill gap. Now, even when the patient or the professionals, they are even skilled, but still they are not. We can say they are not. They're not revamping their information again and again. They are not getting up to date. So that is creating a skill gap. Even the people are trained, they are not up to date, and that again creates a lacunae in the cancer care, which we talk about in a global aspect. So it may be not present in one country, but it is surely present in other countries. So there are many countries in the world. Some are high background, some are high income groups, some are low income groups. So there are still this issue is present. Next, the issue is you can say integrity in the efforts which we are taking. Everybody, in every country, are taking some efforts, but the problem is there, it is not integrated. So everyone at every level has to come up and integrate all their efforts so that we can combinedly give a very large effort for fighting the cancer, to give best possible cancer care to the patient. Like government, they have to invest a lot in the healthcare sector. Cities, now it is a fact that by 2050, more than 60% of the population in our world is going to live in the urban area. And what do you think is the state of the urban area now? Like we talk about metro cities in India also, the air, it is, you can say it is very toxic now. Sometimes it becomes so toxic that it is very difficult to even breathe in. So we have to prepare our cities such that our population in future can live without having risk of developing many cancers, which are obviously because of the risk factors of the environment in the cities. Now we talk about companies again, factors which we can say the efforts with the company or the employer has to do for the employee so that they can be least affected by the harms which can be because of some industry. School, why school? Now, because that is the place where the students are building their behavior, they're building their habits. And if we make them to understand good habits, if we make them to practice good habits, what happens is they develop those habits throughout the life, and obviously they will develop good habits, and obviously they will have less risk to develop the cancers later on. Like they can avoid smoking, they can avoid alcohol consumption if we teach them about ill effects of alcohol and smoking in the school itself. So that remains embedded in their mind throughout their life. So these all are issues. In the last, I like to mention a quote that your health is an investment, not an expense. But yes, you have to invest in the health now so that you can prevent expending a lot in future. So this we individually have to think of, we as a government, we have to think of. So by this, I'd like to end my presentation. Thank you for the patience listening. Thank you all.
Thank you, sir, for highlighting the key issues in cancer care. As we know that the burden of cancer is having a great physical and psychosocial impact on individual and family as well. With the aim to acknowledge these impacts, I invite Dr. Beenu Matthew Ma'am, Assistant Professor, College of Nursing, AIMS Raipur, to present her talk on beyond physical, mental and emotional impact of cancer.
Good afternoon, respected Director Sir, respected Dean Sir, Siddharth Sir, and all the organizing team members. Thank you for your valuable time. Today I will be taking about the impact of cancer. So we have already discussed about beyond physical. So physical has been dealt in detail. Now I will be dealing with the mental and emotional aspects of cancer. Quote, out of suffering have emerged the strongest souls. The most massive characters are seared with scars, according to Khalil Gibran, unquote. Introduction. The impact of cancer goes far beyond physical health, impacting the mental and emotional well-being of not only the patients, but also the caregivers. Common psychological effects include anxiety, distress, and depression. The roles have changed because of this life-changing experience. In the school, in the home, and in the workplace, it can be affected. So as health professionals, we have an important role to help them recognize these changes and get help when needed. Mental health concerns. It is estimated that up to 1/3 of people treated for cancer in hospitals have a common mental health condition. Rates of major depressive disorder are thought to be up to 3 times higher than in general population. Anywhere from 8 to 24% of people with cancer are also living with depression. And mainly the young adults are at greater risk for depression and other conditions compared to adults with cancer. And we overlook generally the common reactions after the diagnosis. We are treating the patient, we are giving the medications, but the emotions and the reactions are not handled properly. So after the diagnosis, there will be shock and denial, frequently followed by depression, anxiety, anger, and fear. So as a combined team, we should provide the management of emotions also. So mental and emotional well-being, if you see, one important thing is to note that the psychological effects of cancer, it affects patient in all the stages, whether the patient is in stage 1 or stage 4, the impact is same. We ourselves know when we were testing for COVID, so till the result comes, we have that anxiety and worry is there. So we can think from the patient's point of view and their emotional response to cancer. It impacts their mortality and morbidity. So it is very important to maintain that balance. So what is emotional wellness? It is having a positive attitude, having a high self-esteem, a strong sense of self, and share the wide range of feelings. Yes, we have to share that feelings. So there should be an opportunity to vent out these feelings in a constructive way. So quality cancer care, as sir has told about all the facilities, along with that, we should incorporate the mental health aspects, that is the holistic aspect of the holistic care, as sir has already told, comprehensive cancer care. So how we can take care of these feelings? First is by preserving the dignity of the individual. Second, taking care of the body image and sexual well-being issues. Third, people-centered dignified care. Fourth, support and care to the patients. Fifth, caregiver support. That is very important because they are the people who will be having burnout and stress. Then the power of colleagues and friends. That is also very important. So how we can preserve the dignity? We have to respect the individual needs and preferences. We have to allow them to communicate and ventilate. Third, we have to empower them. If they don't have the information properly or misinformation, we should change that misinformation and empower them to take informed decision and actively participate in planning care. So this will go a long way in helping the individuals to gain a sense of control and also preserve their dignity throughout their cancer journey. Next is body image and sexual well-being. We all know everybody is looking after their own body, right? So if the body is distorted or the image is changed, it creates a lot of emotional impact on the individual. Physical changes such as the removal of a part of the body, hair loss, speech, impairment, or urinary incontinence. This can affect the way a patient look and feel about themselves. Moreover, there are issues of body image and sexuality that can have a significant impact on the partner relationships with cancer patients. And the survivors, they face these issues about self-esteem. They feel that they are not worth living. And the sexual intimacy is also affected. So counseling should be done on these issues so that they can come out of these issues. Then support and love. Studies have found that cancer support groups can enhance self-esteem, reduce depression, decrease anxiety, and improve relationship with family members and friends. So for a person living with cancer, strong emotional support and loving relationship. So there should be partners, families, and friends who can make a big difference or impact in their lives. Then people-centered dignity conserving care. So what is the meaning of that? That we have to involve them in decisions, empower them, and all their needs should be taken care of. Not only their physical ailments, their worries, their feelings, their attitude, everything has to be taken care of. Physical, emotional, spiritual, and social. So body, mind, spirit interaction should be taken care of. Caring of mind is equally important as caring of body. Caregivers. So most important chunk of the person who experience depression are the cancer caregivers. Most commonly are the partners, family members, or friends. What happens? They receive very little information or preparation or support to carry out their vital role. So we are empowered to help them to overcome this situation and carry out this vital role. Often caregivers, they put their own needs and feelings aside to focus on the person with cancer. So what happens? They become socially isolated and depressed in some cases. So we have to, as professionals, we should give care to the caregivers also. Then this is a very important topic. Now we all know during COVID also, the importance of talking to friends, colleagues, and others. So it has a positive impact on our recovery. Many people living with cancer want to return to work. Sometimes the people at work make a vital network of support. Talking about cancer with colleagues, as well as keeping in touch during work absence, can have a positive impact on recovery. So as employers or employees, we can find out about our employees or workers or the colleagues or our friends and talk with them when they are not well. So that will have a definite positive impact on their recovery. So what can we do, as sir told? Siddharth sir told, as individuals, we have to dispel the myths and misconceptions, give information. As caregivers, we also have a role to find out the support services available. Then as employers and colleagues, what we can do? We can give them flexible working hours. We can create an open environment to talk if they want to talk or if they don't want to talk also. So we have to give them space and time and give them support. Survivorship. So this is like surviving a fatal disease. So survivorship focuses on holistic health management and all issues which are affecting the people after the primary treatment for cancer. So it is during all the period of time, including follow-up care, the management of late side effects of the treatment, improvement of quality of life, psychological and emotional health. So all should be included along with healthcare team. So few tips how to cope up with emotion, express your feelings. Second, don't blame yourself for your cancer. So what happens in patient? Patient feels that because of their sin or something or some wrong which they have done, they are having cancer. So this has to be incorporated in their mind that they should not blame themselves. It is a disease. Don't try to be upbeat if you are not. You choose when to talk about your cancer. Look for the positive. Find ways to help yourself relax. Be active. Look for things that you enjoy. Look at what you can control. Key points. Cancer does not just affect your body, it can affect your mind, and many people will experience significant changes in their emotional health. Everyone knows it is better to catch cancer earlier at stage 1 instead later at stage 4. The same is true for mental health conditions. So prevention is always better than cure for depression. But it is important to remember that there is hope and help available. Mental health treatment can improve survival rates. Mental health screening can help, which we should do in our OPDs also. Almost all cancer survivors face psychological and emotional issues many years after treatment also. The good news is that you don't have to suffer alone. There are therapy, there are support groups, there is social media and community resources available, which will help us to cope up with these issues. The step with coping is realizing that you have an issue and have the courage to come out for help. This World Cancer Day, we recognize our commitment to act, which will lead powerful progress in reducing the global impact of cancer. It is not just a day. That is why our campaign should be built to inspire change and mobilize action. As Nanda sir told, we have the themes for next year's also. Mobilize action long after the day itself. A multi-year campaign helps to create more exposure and engagement, more opportunities to build global awareness, and ultimately more impact. So these are the references. Thank you very much for your patient listening. Thank you all.
Thank you, madam, for acknowledging the impact of cancer, a very important aspect in the cancer care. So let's think about some cancer statistics in India. A report by ICMR, National Center for Disease Informatics and Research, Bengaluru, suggests that in India, the number of new cases of cancer was estimated around 1.39 million in 2020. One woman dies of cervical cancer every 8 minutes in India. For every 2 women newly diagnosed with breast cancer, 1 woman dies of it in India. Mortality due to tobacco use in India is estimated at upward of 3,500 persons every day. Then tobacco, smoked or smokeless, use accounted for 3,17,928 deaths approximately in men and women in 2018. So the top 5 cancers in men are oral, lung, stomach, colorectal, and esophagus, and in women are breast, oral, cervix, lung, and gastric cancers. So these cancers in men and women account for around 47.2% of all the cancers. And these cancers can be prevented, screened, and or detected early and treated at the early stage. So this could significantly reduce the death rate from these cancers. So these data, it shows a huge gap in the care, and to know the cause of gap, we must learn about the barriers which are there between the care and the people. So with this aim to highlight the barriers in cancer care, I invite Dr. Solomon James, nursing tutor, College of Nursing, to take his topic.
Thank you, ma'am. Honorable Director, sir, respected Dean, sir, respected Dr. Siddharnanda, sir, respected Binu Matthew, ma'am, respected faculty members, staff members, colleagues, students, delegates, good afternoon to all. We have already seen about equality and equity, so which is already discussed. So inside the equity gap, we are having the barriers in cancer care. So what are these barriers? So when barrier is there, it is an obstacle, so we cannot move forward. So that will be difficult. So what is there for it for cancer patients? So that will be reducing the patient's chances of being diagnosed and treated quickly, so that they go for the later stages of cancer. So mainly the barriers includes the poor cancer awareness, suboptimal knowledge, and poor accessibility and low affordability. So they are unable to pay for the treatment, logistical, financial, and psychosocial barriers are there. So the major objective of early diagnosis program, so it includes, we need to reduce the prevalence of these barriers. So when barriers are prevented, the patients will be going for early screening, and it will be diagnosed at an earlier stage with a low cost treatment can be done for the patients. So inside the equity gap, we have seen the social determinants of health. So that determines what are all the factors that is showing a gap, so that which is standing in between the client and the cancer prevention, diagnosis, and treatment. So the social determinants of health includes where you live, who you are, where you come from, what you do, and what you love. So if a person is a VIP, if he's having more money, so he can have easy access, I can go to private hospitals, get the treatment. So, but for a poor person, so what is the aspect? So government has given a lot of preferences and schemes for treatment of patients, so especially for cancer also. So what are the barriers to the cancer care? So first one is the gender norms and discrimination, barriers for minority populations, poverty and socioeconomic status. The other one is the rural-urban divide, age discrimination, refugee status and forced displacement, homophobia, transphobia, and related discrimination. So these are the 7 barriers which we'll see one by one. So gender norms and discrimination. So usually women and girls, they suffer from the discrimination, so that women should be in the home and they should do the gender roles, so that they're having lack of access to cancer care. So along with the cultural and the religious context, the stigma and ostracization, that is, they are isolated from the society, and main aspects of cervical and the breast cancers, so that they think of that and they are not going for cancer screening. And in some parts of the world, the women require permission from the head of the family, mainly the male, to go and meet a doctor. And men also are also facing the negative effects of discrimination. So in case if there is a risk for prostate cancer, and again, they don't want to go to doctor after the surgery, there may be impotence or incontinence. So that in the society, it will be a taboo, maybe a cultural taboo also, so that they don't want to have access for the treatment or for the early diagnosis. So next is barriers for minority populations. So racism may be there, and minority populations, so they have a very less access to the cancer care. So indigenous people, so those who are living in the same place or the native of the place, they are having the poor health outcomes. So that there are a lot of discrimination in the systemic ways, human rights abuses, language, and the cultural differences. So many high-risk factors are there for them to get the cancers, or the exposure to poor nutrition, substance abuse, maladaptive behaviors. The next barrier is poverty and socioeconomic status. This poverty is limiting access the people to the cancer care. So people will be living in remote locations, so that out of the city, and they are in a having a very long distance, so that transport may not be available for having the treatment. And those who are having less education, mainly primary education or less, or when there is no health insurance for them, so there will be financial catastrophe, or when they have a cancer, they may die within 12 months if it is diagnosed in the later stages. So this will be the impact of poverty and socioeconomic status. Next is the rural and the urban divide. So rural people, they are not having adequate access for the cancer treatment, lack of prevention, screening, so that transport facilities are also difficult, so that treatment for them to go off will be at the later stages, so that appropriate treatment will not be getting follow-up, and supportive services will be lacking for them. In urban areas, so there are a lot of hospitals and government hospitals with cancer facilities, so they can have easy access to the facilities. So next is the age discrimination. So as the age increases, there is increase in risk for the cancer. As the old age people, they are having more symptoms, and the early cancer symptoms may be there as like they are having everyday pain, which whether they are having their old age. So that, and they will be diagnosed at the later stages. And many of the cancers, mostly more than 50% of the cancer, it occurs for the old age people. Refugee status and forced displacement. So when they become a refugee, they go to a different land, or areas where there is a conflict, or there is a war, or after the war, so that all the access to the cancer services will be affected. So they cannot have hospitals, healthcare workers might have died because of the war which has happened, so that a lot of refugees may be there, or people will be going to different countries as refugees. For them, the treatment will be very much difficult. So the physical, emotional trauma will be there, limited financial resources, and there are language and the cultural barriers they are facing. So next is homophobia, transphobia, and related discrimination. So there usually homosexuals, they have the hostility and discrimination even from the health practitioners. There is prejudice. So there is fear of poor treatment, so that they don't go for treatment. And there are some of the behaviors that will be increasing the cancer risk, so as we see drinking, smoking, or illicit drug use. So that people, they try to self-medicate themselves and they cope, and they think that the world is hostile and they don't want to be in the world, so they live in their own world. So what causes the delays in cancer diagnosis and treatment? So as and when the first symptom occurs, so the causes of delay, it can be so access delay. So because of the poor cancer awareness. So then they go for the first visit to doctor, and there can be diagnosis delay, which can happen mainly because of poor performance or else referral issues, which is there, as Dr. Siddharth Nanda sir has already mentioned. And again, after the diagnosis is made, there can be treatment delay for the patients. It would start the first treatment delay can be there, as they may be on the waiting list for the radiotherapy or the chemotherapy, or for the for getting funds and suboptimal resources which are there. And overall causes of delay, it can be the financial barriers, logistical barriers, psychosocial barriers. So we need to overcome these barriers for providing a proper cancer care. So how we can overcome these barriers? So we need to increase the cancer awareness among the people by giving adequate education, and the television advertisements can be given, so observing the World Cancer Day. And we need to provide adequate knowledge about the cancer. We need to increase accessibility and affordability for the people. So financial assistance can be given for the cancer patients. And what will be the role of the oncology nurse navigator? So oncology nurse navigator, they help the patients to overcome these barriers as they come for care, so that care is given for them, education is given for them, and they act as an advocate for the patients. They provide patient education, they follow the patient throughout the continuum of care. So they remain connected. So until the acute stage of cancer treatment is completed, and they guide them and the transition of short-term and long-term survivorship, so that their physical, their mental and emotional impact is also taken care, as told by Dr. Binumati ma'am. So that till for the survival, they are being helped by the oncology nurse. So let us fight against the cancer, and we can show there is a hope for cancer. Thank you all.
Thank you, sir, for highlighting the important barriers in cancer care. COVID-19 has affected daily life around the globe, and the challenges it poses can be particularly difficult for people with cancer and their loved ones. Some cancers and cancer treatment may increase the risk of severe illness from COVID-19. So let's learn how people with cancer can protect themselves and what they should do if they have symptoms of an infection. So I invite Mr. Abdul Munaf, Nursing Tutor, College of Nursing, to describe some important facts on cancer and COVID-19.
A very good afternoon to all. Respected Director Sir, respected Dean Sir, respected Siddharth Nanda Sir, and respected Binumati ma'am, and my dear colleagues and all other students who have joined, and the delegates who have joined online. Myself, Abdul Munaf, Nursing Tutor, College of Nursing, AIIMS Raipur. So I'll be dealing with the topic COVID-19 and cancer care. So as we know, COVID-19 has impacted a lot overall healthcare delivery system. No, complete healthcare delivery system is drastically affected by the COVID-19, where we have seen many changes even in the COVID time. We didn't experience that much in the third wave, like in second wave we might have seen. Like even in the newspapers, most of the areas we have seen, we are not getting the beds for the patients. So in that time, specifically, I don't tell only about the cancer care. Most of the other services, like everybody's focus was on COVID-19. So, but I proudly say, AIIMS Raipur Department of Radiotherapy, as our Siddharth Nanda sir told, like even during the second wave, in the peak of that time also, we did not stop any services which are related with the cancer care, like radiotherapy, chemotherapy, brachytherapy, any of the services, we continued the treatment. So that I proudly say that. So where other areas have been globally in overall, even in Indian setup also, if you take, overall it is affected a lot. Just we have a look. So just we see impact of the COVID-19 pandemic on cancer services. As I have told you already, it is impacted a lot. So, but our focus should be just, I want to bring your attention on the two aspects where we'll talk about the cancer means we think of two aspects. One is cancer screening. Second point is cancer treatment. So especially in Indian population, where almost 70 to 80% of the population who are living in the rural areas, where the proper screening facilities or treatment facilities are not available at all. Even though because of COVID-19, like we have experienced the lockdown, so because of that, the rural people cannot able to come for their routine screening. So even for the treatment purpose also, they could not be able to come for the routine screening, because most of the cancer centers or cancer care providing centers and hospitals which have been set up in the urban areas. So that's why it is impacted a lot. But cancer screening facilities, it should be provided in each and every hospitals, each and every setup, even in the rural areas also. If at least who are the medical professionals who are available with the help of even the paramedical professionals, routinely if you go for routine screening. So as we know, if you identify the cancer in early stage, like stage 1 and 2, we have better prognosis, a better outcome we can get, so that survival rate will be a little more faster, a little more better. But same thing, if you neglect, for example, if you take because of this COVID-19, if you delay your screening, if you have been diagnosed and if you don't start the treatment. So if you delay in your screening, or if you don't delay in your treatment, means progressively, like commonly one word we say, for stopping the COVID, we can have quarantine. But if you quarantine the cancer patient, means cancer will not stop, right? So exactly, for stopping the cancer, only one way is you need to early diagnose that. You need to screen the patients, you need to screen all the population, so that who are all under a risk category people. If you screen them, means you will be diagnosing, you will be identifying in early stage. So like in early stage 1 and 2, we have better prognosis, better outcome we can get by whatever the available facilities we have. In government also focusing on cancer treatment, like radiotherapy, chemotherapy, and other surgical modalities. So these services will be provided. So this is about your screening aspect. The second aspect I want to talk about is a treatment aspect. After diagnosing, treatment will be focusing like chemotherapy or radiotherapy. So by consulting with your who are the treating doctors, like once you diagnose with the cancer, you will be active patient of the cancer. So you will be active patient of the cancer during that time. If you feel like, so because of COVID, I cannot go to the centers, because of COVID, I cannot go to the hospitals, like that. If you fear, because of the fear of particular COVID-19, if you don't come for the treatment, means again, whatever the diagnosis conditions will be there, it will be progress. Again, your outcome will be reduced. That's why you need to talk to the people. You need to especially talk to the consultants or the doctors through any modes, like virtually. We have many facilities like teleservices who are available. Like virtually, you can contact through the video calls. Also, you can talk to your doctors so that they can betterly guide you, especially for the active patients. Okay, if newly diagnosed patients, so you don't need to wait for the particularly quarantine cases. Like you need to come for the hospital at least 1 or 2 times, get your chemo or get your radiotherapy, so that at least next you can keep on delaying the little services, like maybe 1 week, after 2 weeks, like that you can delay. But for active cases, especially these things will be applied for rapidly progressing tumors, like blood cancer we say. So for those kind of cases, if you delay your treatment, means again, those cases will be rapidly progressing. Again, it will be very much harmful for your health. So that's why for the solid tumors, like if you're talking about like radiotherapy or some other adjuvant chemo or radiotherapy, in that case, by consulting with your doctors, you can delay for some more time. And this is for the active patients. The people who have completed some of the cycles, like 3-4 cycles they have completed and their symptoms have been reduced. Then if you talk to your consultants, so that if they say, like whether is it okay to continue, or is it okay, you can delay some more this treatment for some more time, like that if you do, means particularly it will be very much helpful for improvement of health, particularly in the cancer aspects. So this impact, according to UICC, where a Union for your International Cancer Control, because of COVID impact, they also started your virtual dialogues, where in May 2020, they started your virtual dialogues, because for the experts' opinion, expert view on particular COVID and cancer care, like it is been drastically affected the cancer care. So most of the others, most of the other services, so virtually they get the experts' opinion. In this case, what we have to do, Like they virtually they will be connecting, like consultants, doctors, seniors, all will be connecting, so that they will be having and finding out what can be the solution for that, how we can provide the better services to the society. Like that they can think of, and virtually they will be providing. Like we have some other facilities you will see here, like one slide I have got here, and during the time of last one webinar, in cancer webinar, I have found that. So in these cases, especially the patient who is found COVID positive, who had been taking already chemotherapy treatment. So for those kind of patients, like isolated single room, from the outside only, outside itself, they will be having the infusion pumps from the drip sets, outside salines, whatever the saline bottles will be there. And that's from the maybe central lines, usually will be preferring from the central lines. They will be connecting the port from there, from the inside room, they will be bringing it to the outside. And from there, without getting direct contact with the patient, with less contact. So for the COVID positive patient also, they will be providing the chemotherapy. So this is one example. So this is a new innovation. Like I have told you, like innovations and adaptation in case of COVID, especially in the cancer case. Like that, even we have some other facilities like we see here, like telecommunication, especially teleservices, like medicine services, or video telecalling, especially like virtual calling, video webinars. Through that, the cancer patients, they can directly contact to your consultants or treating doctors. So whatever the problems you have, so they can get it done, whatever the services they want. This is about innovations and COVID-19. The second point, disruption of COVID services during the time of cancer. Especially, there is a lot of disturbance because of the lockdown, as already I have discussed this one. So you see here, like complete India is locked down. Like we have experienced this one initially, people were having a lot of fear in case of first wave. Even one patient found positive, complete area will be sealed, complete area will be locked down. Like that, complete India got locked down because of this COVID, and even the whole world also locked down. So many of the services, any services to take, medical health, other things, all the services got affected. Because of that, people cannot come to the hospital. People are not having, one important in that aspect was people were having a lot of fear. Because of this COVID, if you come out of the home means these all things happens. So that was not a fact. Like I have told you, COVID, we can contain or we can restrict the COVID by quarantine, but you cannot control the cancer by quarantine. So you have to come. So you have to come for the hospitals. You have to talk to your doctor so that get the treatment done. So this is the lockdown is the best way where we have found. So it has drastically affected our cancer services. And this is one example where UICC, like your Union for International Cancer Control, virtually, they have dialogues with the experts. They have opinions they'll be getting. They'll be planning for the future in case of severely any of the impact, COVID impact has come means what we have to do. Like that, the expert will be getting the opinion from different people. Even they'll be providing the opinions for your patients also. Like that, these are the some points. Just I want to lighten the COVID-19 and cancer care. So with this, I complete my topics, COVID-19 and cancer care. I take this opportunity to thank you all, respected Director Sir and Dean Sir and Siddharth Nanda Sir, Binu Matthew Ma'am, and all the organizers for giving me an opportunity to talk about World Cancer Day observation. Thank you very much, sir.
Thank you, sir, for enlisting the important facts. There is a information for the participants. We have sent a link in the chat box for feedback. So all the participants are requested to give their feedbacks. The link is there in the chat box. So on this World Cancer Day, e-poster competition was also organized, and the theme for the competition was the same. That is the theme for this year. That is close the care gap, realizing the problem. So there were total 18 entries for this competition. And now I feel happy to announce the result for this e-poster competition. So I would like to start with the 6th position. So the 6th position is for poster number 10, Kaushali Goli, BSc Nursing BSc Honors Nursing second year student.
Yes, ma'am.
This is 6th one.
6th. And we are also displaying their posters also. All can view that. So the sixth position is for poster number 10, Paushali Goli, BSc Honors Nursing second year. Fifth position, it goes to poster number 11, Raj Nandini Singh, BSc Honors Nursing second year.
Yes, ma'am.
Fourth position is for poster number 5. Fourth position is for poster number 5, Sneha Shaji, BSc Honors Nursing, third year student. Third position is for poster number 16, Dimple Singh, BSc Honors Nursing, fourth year. Second position, poster number 15, Anupriya Ghatak, BSc Honors Nursing, fourth year student. And finally, the first position, it goes to poster number 18, Srijita Chattopadhyay, BSc Honors Nursing, fourth year. So many congratulations to all the participants and also to and the prize winners. The participants, they can receive their prizes from the organizing committee after this program. And the feedback form is compulsory for the certificate. So from those participants, we are getting the feedback. They will be receiving the e-certificates. So now this is the time to thank and present our gratitude. So I would, to our honorable guests and speakers, so we would like to present a token of gratitude and remembrance to our honorable director, sir, Professor Dr. Nitin M. Nagarkar, sir. And unfortunately, sir is online, so we will be happy to present this token of gratitude.
Thank you, sir.
Next, I request Dr. Siddharth Nanda, sir, to present a token of gratitude to our honorable dean, sir, Professor Dr. S.V. Dhaneria, sir.
Somebody there to take a photograph. ये वो कहाँ चलेगा?
Thank you very much. Thank you.
Thank you, sir. Now I request our honorable dean, sir, to present the token of appreciation to all our speakers. So first, I request Dr. Nanda, sir, to please come forward and receive the appreciation.
यहाँ पे ठीक रहेगा? हाँ. ये कर लो.
सर इधर फेस करेंगे सर.
इधर तो सर का भी दोबारा करना.
नहीं हो जाएगा. आजा.
Thank you, sir. Yes. Thank you, sir. Thank you very much.
I request Binu Matthew ma'am to please receive this appreciation.
Thank you.
Dr. Solomon James, sir. Mr. Deepak, sir. Now I request Dr. Nanda, sir, to please present this token of appreciation to Mr. Deepak, sir. Now I request Mr. Abdul Gunaf, sir, to please receive the token of appreciation.
Thank you very much, sir. Thank you.
Thank you, sir.
Thank you.
Now I would like to invite Mrs. Roisha, nursing tutor, to propose the vote of thanks.
Thank you. No duty is more urgent than that of returning thanks. It's my privilege to have been asked to propose a vote of thanks on the occasion of World Cancer Day observation. I would like to thank our respected director, sir, Professor Dr. Nitin M. Nagarkar, sir, who spared time from his busiest schedule to grace the occasion and for sharing valuable thoughts. Thank you, sir, for always being a constant support and guidance for us. Thank you, sir. I would like to express our profound gratitude to our respected Dean, sir, Professor Dr. S.P. Dhaneria, sir, for his constant support, guidance, and encouragement. Thank you, sir. I would like to extend our sincere gratitude to respected DDA, sir, Mr. Anshuman Gupta, sir, for his constant support and encouragement. Thank you, sir. I must express my deepest sense of appreciation to Dr. Siddharth Nanda, sir, Additional Professor, Radiotherapy Department, AIIMS Raipur, and Dr. Binu Matthew, ma'am, Assistant Professor, College of Nursing, AIIMS Raipur, who were the backbone in organizing this program successfully and for sharing your work. Thank you, sir. Thank you, ma'am. I extend my sincere thanks to other respected speakers of the day, Mr. P.D. Deepak, Dr. Solomon James, and Mr. Abdul Munaf, Nursing Tutors, College of Nursing, AIIMS Raipur, for sharing your knowledge and thoughts. I extend my gratitude to all participants, faculties, staff, and students who are highly motivated and whose participation made this event a successful one. An event needs proper planning and work. We have been fortunate enough to be backed by a team of very motivated and dedicated colleagues, IT department, PRO department, office staff, and other members of organization team. I express my sincere thanks to the entire organization team for the success of this program. To conclude, let me once again reiterate my gratitude to all. Thank you.
Master of ceremony.
Sure.
Thank you.
Sure.
For their wonderful contribution,
Wonderful.
and as always, you've been presenting and
Thank you, sir.
conducting the program so well.
Thank you, sir.
Thank you very much.
Thank you. Supporting us, sir. Always.
मैंने बोला था
Thank
लेके
you,
आ जाना नीचे।
participants. Now we would like to conclude the session, today's session. Thank you all for your participation, and participants are requested to fill the feedback form. Basis on that only, the certificates, e-certificates will be provided to them. Thank you all.